What do Catherine Zeta-Jones, Demi Lovato, Jean-Claude Van Damme, and Carrie Fisher, and Russell Brand have in common, apart from being famous? They have all been open about their struggles with bipolar disorder, and they are in good company, with about 2.8% of adults in the United States having been diagnosed with bipolar disorder at some point in their lives. So, what is bipolar disorder? Well, bipolar disorder is a mental health condition that is caused by extreme changes in mood, energy, and behavior. These mood changes or mood episodes can range from feeling very high and energized, called mania or hypomania, or feelings of being very low and depressed. During a manic episode, a person with bipolar disorder may feel excessively happy, energetic, and restless. They may also have racing thoughts and make impulsive, reckless decisions, or feel like they're invincible and can take on the world. A hypomanic episode is similar to a manic episode, but the symptoms, well, they're less severe. During a depressed episode, a person with bipolar disorder may feel sad, hopeless, and lack energy. They may also have difficulty concentrating, sleeping, and making decisions. Just getting out of bed can be a struggle. Bipolar disorder is a chronic condition, which means that it tends to persist over time and may require ongoing treatment to manage symptoms. It's important for people with a bipolar disorder to work with a mental health professional to develop a treatment plan that includes medication and therapy. Now, there's two types of bipolar disorder, type 1 and type 2, and these have different patterns and severity of mood episodes. Bipolar 1 disorder is characterized by the presence of at least one manic episode that lasts at least 1 week. In some cases, manic episodes can be severe and may require hospitalization, and this type may also include episodes of depression. Bipolar 2 disorder is different. It has at least one hypomanic episode that lasts at least 4 days. Hypomanic episodes are less severe than manic episodes and do not usually require hospitalization. And this type also includes episodes of depression. But even in defining these two types of bipolar disorder, it's important to note that the symptoms and severity of the disorder can vary greatly from person to person. Now, what about diagnosis? Well, bipolar disorder is typically diagnosed by a mental health professional, such as a psychiatrist or psychologist, and their evaluation may include, first of all, a medical history, including previous diagnoses of mental health conditions, family medical history, any medications currently being taken. Then there's a psychological evaluation that will explore mood and energy levels, behaviors, thoughts. There may be assessment tools, such as questionnaires and rating scales, that can help identify symptoms of bipolar disorder. And finally, there can be a physical examination. This may be part of the information gathering to rule out other possible, especially organic causes of the symptoms. Now, bipolar disorder can be difficult to diagnose as the symptoms may be similar to those of other mental health conditions or may be attributed to other factors such as stress or substance abuse. And it's also common for people with bipolar disorder to have co-occurring mental health conditions such as anxiety, eating disorders, or substance use disorders. Now, according to the DSM-5, the diagnostic criteria for bipolar disorder includes the presence of one or more manic or hypomanic episodes, as well as the presence of one or more major depressive episodes. To meet the criteria for a manic episode, an individual must experience a period of elevated or irritable mood, energy, and activity levels that last at least 1 week. During this period, they must also experience at least 3 of the following symptoms: inflated self-esteem or grandiosity, decreased need for sleep, more talkative than usual or pressure to keep talking, racing thoughts or flight of ideas, distractibility, increased goal-directed activity or excessive involvement in pleasurable activities that have a high potential for negative consequences like reckless speeding or sexual promiscuity. To meet the criteria for a hypomanic episode, an individual must experience a period of elevated or irritable mood, energy, and activity levels that last at least 4 days. They must also experience at least 3 of the above symptoms, but the symptoms must be less severe than those required for a manic episode and must not cause significant impairment or social functioning. Now, to meet the criteria for a major depressive episode, an individual must experience a period of persistent sadness, hopelessness, and loss of interest or pleasure in most activities that last at least 2 weeks. They must also experience at least 4 of the following symptoms: decreased energy or fatigue, difficulty concentrating, remembering, or making decisions, insomnia or oversleeping, appetite changes or weight changes, thoughts of death or suicide thoughts, feelings of worthlessness or guilt. Now, these symptoms can vary greatly from person to person and may not always fit neatly into these diagnostic criteria. Now, there's another condition called Psychotherapy disorder that has more frequent shifts between mood swings, which is called rapid cycling, and we'll cover this in a separate video. So how common is bipolar disorder? Well, it's probably more common than you think. According to the National Institute of Mental Health, the prevalence of bipolar disorder in the United States is approximately 2.8% among adults. This means that about 2.8% of adults in the United States have been diagnosed at some point in their lives. The prevalence of bipolar disorder is similar in other countries, with around 46 million people worldwide with this diagnosis. There are several treatment options available for bipolar disorder, and like any mental condition, the most effective treatment plan will depend on the specific needs of the individual. Some of the main treatment options for bipolar include medication. Antidepressant medication, mood stabilizers, and antipsychotic medication are commonly used to treat bipolar disorder. These medications can help to balance mood, reduce the frequency and severity of mood episodes, and prevent future episodes. Lithium carbonate has been very successful as a mood stabilizer by helping regulate magnesium levels, but it doesn't work for all patients. We also have a very interesting interview with Dr. Brian Quinn, who warns about the use of antidepressant medication in the case of bipolar disorder, and so that one is worth checking out. We also have psychotherapy, an important part of an interdisciplinary approach to bipolar disorder, and I'll cover a bit more of this a bit further on. And then there's self-management strategies. People with bipolar disorder can also benefit from learning about managing themselves, setting consistent daily routine, getting regular exercise, and practicing relaxation techniques. And finally, supportive care, such as education about bipolar disorder, social support, and access to resources can be an important part of the treatment for bipolar disorder. Now, what role does a psychotherapist play when treating bipolar disorder? A therapist can provide an important supportive role for patients so they can better understand their condition, identify triggers for mood episodes, and develop coping strategies to manage symptoms. There's a number of types of psychotherapy interventions that can help for individuals, including CBT, cognitive behavioral therapy, interpersonal and social rhythm therapy, this focuses on helping individuals establish and maintain a consistent routine, which can help reduce the risk of mood episodes. Family-focused therapy, involving family members in the treatment process to improve communication and support within the family. And group therapy can provide a supportive environment where individuals with bipolar disorder can share their experiences and learn from others. In fact, any therapy where there is an understanding and empathic therapist willing to provide a safe place, really listen, and support patients as they navigate what can be a really stressful journey is going to be of great benefit. Bipolar disorder is a serious condition, but with proper treatment and support, individuals can lead fulfilling and productive lives. Now, if you've been diagnosed with bipolar disorder, remember that you are not alone. This is a common condition that affects millions of people around the world. There are many resources and support groups available to help you manage the condition and connect with others who are going through the same thing. There are effective treatments, and with persistence and patience, you can find relief from symptoms and live a fulfilling and productive life. And don't forget that you are not defined by your diagnosis. You have strengths and talents and skills that are not related to your diagnosis, and it's important to appreciate all of who you are. Thank you for tuning in to the Science of Psychotherapy. Please like this video, subscribe to our channel, and hit that bell so that we can reach more people and bring you more Science of Psychotherapy. And if you're a mental health professional, check us out at thescienceofpsychotherapy.com.